Hey guys, what's up? It's your girl Jay. God bless everyone. Welcome back to my channel. If you are new, then welcome to my channel. My name is Jahaira. If you're returning, then thank you for returning and viewing my content, where I mainly talk about nursing, lifestyle, and much more. So, don't forget to like, share, and smash that subscribe button and hit that bell notification for updates on my content. And help me reach 200 subscribers. And what will we be talking about? So today I will be talking about why I quit home care and more in depth about what happened and why did it happen. So guys, if you're interested, then tag along. So as you know, I had applied literally like 3 weeks or 3 to 4 weeks back for a home care job, and I got the job, thankfully, thanks to God. The interview process went pretty well, I believe. And then also that I went to a new hire orientation, and I really like how the whole process went because it was very smooth and concise, and they knew what they were doing. It wasn't like scattered or anything like that. So I really like that because administration was very on top of their paperwork. So then I went to also the trach and vent training that I made that video for you guys. And after that, I just basically sat down all day there and I watched the training, and also they showed us mannequin um, examples of how you would do this and that, and we would practice and stuff like that. Also, guys, after that, I went ahead and I did a meet and greet with a potential patient or client that I was going to be taking care of, and it was a pediatric patient, so it was a little kid. And the mother was super calm and cool, and she was Hispanic, and she really loved me, and she wanted me to work with her son and just kind of take up a shift that was going to be opening up soon for like a part-time slash full-time schedule. But um, after that, I kind of like had an eye opener because when I did the meet and greet, I had to go to her house and just see the scenario of how the environment was gonna look, how I was gonna like not react, but how I was gonna interact with the child, if it was gonna be like a good combination, if it was gonna work out, and basically stuff like that. So I did have um a good connection with the child, and he was super sweet. Off the bat, he saw me, he hugged me, he loved me, and I come from a background of like a lot of siblings and just always being around kids, so I generally get along with kids and I love kids. But the point was that it was eye opener when I actually realized that I was going to have to be taking care of this child, and the parent was not going to be there, and he was being weaned off of his trach, and also he wasn't even on his vent for like almost 6 to 8 hours a day, so that was a plus because I didn't really have to worry about that. But I was going to be at his home, walking with him outside, taking care of him inside, doing PRN medicine and just stuff like that. And just the aspect of being in someone's home, especially during like COVID times, and dealing with someone else's child is what kind of hit home for me because um, I think home care is a great experience for nurses, but I feel like this would be a better experience for those who are probably going to go back to school because they'll have a lot of downtime and probably have many years of experience, because maybe there's just nurses out there who are very tired of being on the floor and giving their all, that they just want more downtime. But overall, I didn't believe that it was going to be the setting for me because I'm a new nurse, and on top of that, I had already had a lot of downtime as a cardiac monitor tech, that I wanted to expand my horizons, um, basically learn more on the floor and also gain more knowledge. And as a home care nurse, I was just going to have like this one client, and if I picked up more clients, and I was just going to be with this kid, and they call us caregivers, and just take care of him, basically sit down at home, play with him, make him food, just basically like babysit. And it really hit home when I like realized I wasn't really going to be doing any like nursing tasks, besides if a medical emergency were to happen and stuff like that. So I just wasn't really feeling it, and I I'm glad that I realized ahead of the game because I didn't actually take up anybody's job because I just had scheduled trainings. So when I actually like went to the meet and greet, I had like a few days to still think about it. And then afterwards I actually realized like, hey, this isn't going to be for me, and I know that I want to continue my education and I want to actually like learn more things on the job, and I feel like the setting for me would probably be, and I'm 100% hands down sure that it's going to be in a nursing home or a rehab center, just anywhere floor wise that I can, get my feet wet and basically get hands on experience as a new LPN. So, that being said, guys, that is why I left home care nursing. But besides that, I want to say that there's cons and pros, and like I said, a con would be having to go to someone's house versus to one primary location like a skilled nursing facility. So that would be a con, would be traveling. A con would be not having permanent clients or residents, or what they call them is clients, because if this person, the insurance removes them or not able to pay or just something like that, then they're not really permanent. Or if they um, discharge their orders to have home care, then they're not really permanent. Um, Another thing would be pay. The pay varies from patient or client to client. For the home care that I was working for, it was 32 to 38 per hour, but for training, I was being paid 25. So still, it wasn't bad, but I just wish that there was like a set amount. But honestly, it can go both ways. So those are just the three cons. Pros would be that they have great benefits, very flexible for new nurses or nurses who want to further their education. Three, a lot of downtime. If you're thinking about going back to school, this would be the place to start off if you just want to get some experience and stuff like that. Four is very, very chill work. I don't know if that counts or not, but probably look mad. Okay, but anyways, there's a couple cons and pros, and I know this video isn't that much in depth, but basically this is my backstory. This is why I quit that, and these are my cons and pros. And overall, I want to stress to you guys that home care isn't a bad setting. It honestly isn't, but it only is for certain people. Those people who, like I said, want a lot of downtime, probably already had a lot of experience on the floor, and then now want to take time to relax, or probably those who are going back to school and need that downtime. I'm not saying everyone has the same experiences because this is a client based scenario, so every client would be different. In my situation, it was just kids, and the kid that I was going to have um, was basically doing great. He was thriving, doing amazing. I was really happy to see how well he was dealing with things, and it just kind of opened my eyes out and basically helped me understand that that wasn't what I wanted to do. I wanted to basically test my knowledge, what I had learned in school, and put my skills and knowledge out to work, if you can understand what I'm saying, and gain more experience on the floor. But yeah, guys, so that being said, I hope this video is helpful and beneficial to anybody who's trying home care. Like I said, it's not bad. The pay rate is pretty darn good. But if you like to travel and you like to have downtime and just stuff like that, then maybe this is for you. If you don't like to travel and you don't like any of the things that I have mentioned, dealing with parents, dealing with home environments, dealing with pets, siblings, etc., because there's just so much factors out there, then it's something to consider. So, guys, don't forget to like, share, smash that subscription button, subscribe, please help me reach 200 subscribers, and hit that bell notification, guys, for updates on my content. Peace out. God bless.